Rheumatoid arthritis is a common autoimmune disease affecting approximately 1.5 million people only in the United States. Interestingly, many of my patients reported that what they eat will affect how they feel. Is this a simple observation or is this a reality call? In this video, I will discuss about how food can affect your disease and what food choices you should make to feel better. Why should you start exercising and what types of exercises are beneficial? And why to use mindfulness to reduce stress and pain. I will give you tips that you can use, and I will also share with you a food pyramid that I share with my patients. But I will also incorporate into that lifestyle interventions that are proven to decrease your pain, your stress, and your inflammation, and will improve the way that you feel with rheumatoid arthritis. Let's begin.
rheumatologistoncall.com.
Hi, I'm Dr. Diana Girnita, the founder of Rheumatologist OnCall, and I would like to take the opportunity to thank you for watching my channel. How food affects your disease and what food choices do you need to make to feel better? As I mentioned, many of my patients reported that after they eat certain foods, the next day they will feel more pain and stiffness in their joints. Foods like sugar, processed food, fried food, too much salt, or even eating foods with gluten may cause you more pain and stiffness in your joints. Is this a simple observation or is this a reality call? At first, I thought that this was just an incidental report, but then I started to hear it more and more from my patients. It made me curious to find out more. During our medical training, we tend to get super specialized. As a rheumatologist, I learned extensively how to diagnose an autoimmune disease and then how to use a targeted therapy to modulate the immune system. However, I learned nothing about nutrition or the gut microbiome and how that can impact your immune system. In a few years, after reading hundreds of research studies, I was able to find the scientific evidence. And yes, patients were right. Their immune system was massively impacted by the food that they eat, the stress that they experience, and about their sleep. In my practice, I approached the patient from different angles. I started to ask my patients, how do you feel? What do you usually eat? What are the major stressors in your life? How much do you exercise? And how much sleep do you have? Let me give you a few examples. In a study of 300 patients with rheumatoid arthritis that were surveyed about the consumption of more than 20 foods, the patient symptoms were clearly impacted by the food that they eat. Nearly a quarter of patients reported that foods such as blueberries, strawberries, fish, and spinach relieve their symptoms, while sugary drinks or desserts, they worsen the symptoms. Excessive use of salt was also shown to increase the joint pain and blood markers for inflammation. Excluding red meat, gluten, and lactose for about 3 months can also be beneficial in some patients. Now, replacing coffee with green tea was also recently recommended. Eating a diet full of fibers like leafy greens, lentils, beans, soy, or whole grains increases the amount of short-chain fatty acids produced by your gut bacteria, which is also known to be linked to reduced inflammation. Patients that used probiotics for at least 8 weeks experience less joint pain and less swelling. Adding spices to your food or as a supplement, for example, turmeric, garlic, or ginger, were also shown to reduce the symptoms in patients with rheumatoid arthritis. Now stay tuned, because at the end of this video, I will present you an easy way to remember all these recommendations. It is a food and a lifestyle pyramid that I designed for patients with rheumatoid arthritis. Even if you don't have a diagnosis of rheumatoid arthritis, I would encourage you to adopt an anti-inflammatory or a Mediterranean diet, as it will reduce the risk to develop rheumatoid arthritis by 21%. Why should you start exercising, and what types of exercises are beneficial? When you are in pain, the tendency that you have is to avoid exercising. Many patients actually fear that exercise will cause more damage to their joints. Actually, if you suffer from rheumatoid arthritis, exercise is a must and should be part of your treatment. Let me explain you more. During an episode of intense inflammation, the fluid in your joints become thicker, so your joints will become stiffer. When you start moving or exercising, there is more fluid produced in your joints that will cause your joints to loosen up, and you will feel less stiff. As a good friend of mine says, Dr. Andrea Furlan, motion is lotion. If you do not exercise due to fear of pain, in time you may become overweight. Being overweight or obese was associated with higher chances of developing an autoimmune disease such as rheumatoid arthritis. This is why I encourage all my patients to engage in walking, stretching, or swimming exercises. The goal is to reduce pain, inflammation, fatigue, and also improve your joint mobility, your strength, the flexibility of your joints. But exercise will also impact your mood and will decrease your weight. Why to use mindfulness to reduce stress and pain? Many of my patients describe that before their autoimmune disease surfaced, they experienced a very stressful event in their life, like a divorce or losing a job or changing a job, or even losing someone that was dear to them. The question that I had, and probably most of you have, is there a connection between the immune system and your mind? And the answer is definitely yes. Our mind is very well connected to our body and to our gut. This is why when you feel stress, you feel that tension in your gut. But the gut is also where many of our immune system cells live, and it's also the home of the trillions of bacteria. There are many studies showing that these bacteria are actually able to influence our immune system, and they are influenced by the food that we eat. In consequence, if you eat something that is not good, your bacteria will not be happy, will trigger your immune system, and that will create more inflammation and more pain. Now the question is, how can we reduce stress? Or if we reduce stress, are we going to experience less pain? And again, the answer is yes. A 2020 meta-analysis of randomized controlled trials of patients with rheumatoid arthritis. Of 337 patients showed that mindfulness interventions significantly improve pain intensity, depression, and symptoms when compared to a conventional therapy. Now, mindfulness will also decrease the daily pain in patients with rheumatoid arthritis. That is why I teach my patients how to approach pain and how to incorporate simple breathing techniques or guided imagery or other relaxation techniques into their routine. In a matter of weeks, patients will experience less pain, better sleep, and better quality of life. To be easier for my patients with rheumatoid arthritis, I have designed a lifestyle pyramid. It will include the amounts and types of foods needed to prevent or reduce the risk of developing rheumatoid arthritis, but also reduce inflammation and pain related to this disease. It was adapted to include scientifically proven foods with anti-inflammatory properties and exclude foods that can potentially cause more inflammation. In addition, recommendations about supplements, exercise, and mindfulness were added to this pyramid. My patients find it very easy to use and beneficial, and I hope you will find it too. In my next video, I will go over all the tiers of this pyramid and explain to you even more, so make sure you don't miss that video. Considering all the evidence, healthy lifestyle interventions are essential in patients with rheumatoid arthritis. That's why I constantly encourage patients with rheumatoid arthritis to make better lifestyle choices that will positively impact their mind, their health, and their life. Thank you for watching.
Rheumatologist OnCall.com.